Thank you, and thank you, everyone. It's so great to see our amazing team, and I know this isn't all of you. I know we're all kind of all around the county, but it's so wonderful to see you all and see your faces and to be able to celebrate you during this Public Health Week and to really think about how this has been 2 years. It seems like it's been much longer, but how we've been here for 2 years and all that you all have been able to accomplish in that time, and to see even just this area grow. Right? I was like, this is the first time I've actually been through phase 3 since the construction phase of it. So it's so nice to see as we keep growing and keep developing and really seeing our health department even become what we all imagined it would be. So thank you all for your work in that. And we have council has a resolution to present to all of you for public health. Whereas public health promotes and protects the health of people in the communities where they live, learn, work, and play. And whereas during the first full week of April each year, the American Public Health Association brings together communities across the United States to observe National Public Health Week as a time to recognize the contributions of public health and highlight issues that are important to improving our nation. And whereas from conducting scientific research to educating people about health, people in the field of public health work to assure the conditions in which people can be healthy. And whereas public health plays a critical role in safeguarding the health of all individuals, families, and communities, public health initiatives strive to address health disparities and improve overall quality of life for everyone. And whereas the Delaware County Health Department is committed to protecting the health and well-being of all residents by continuing to create a greater understanding of public health practices and offering resources which contribute to healthy outcomes for the community, and now, therefore, be it resolved that we, the County Council of Delaware County, hereby recognize April 1 through 7 as Public Health Week and encourage all of our residents to do their part to show appreciation for all public health professionals in Delaware County, and we commend our Delaware County Health Department team for promoting and encouraging the health and safety of all of our residents. Thank you all for everything that you do every day for us and our residents. Thank you.
Thank you all so much for being here, and I want to thank our council members that were able to join us today. Thank you very much, and for those that were unable to join us, and then our Board of Health representation here, we have PJ Brennan and Lily Higgins. They were able to be here with us today as well, and in all honesty, County Council and the Board of Health has been the visionary behind this health department. And so it has been our responsibility, all of you in the audience, our community partners, and within my leadership to deliver on their vision. So I thank you all for, I'm so proud of the work that we're doing. So I do have a couple prepared remarks. It's a lot of pages. Don't get scared. Most of them are not my remarks. So thank you all for joining us on this special occasion to celebrate our 2nd year anniversary of operation. And as I previously mentioned, establishing a health department is a challenging endeavor. That is why I firmly believe that our staff consists of some of the most courageous individuals. You've heard me say that. You're the most courageous group of people I've ever had to work with. This is a really challenging environment. And I was at a conference and I recently heard that this is public service, not self-service. And so should all be proud to be in this space of being in public service. And we are people serving people. I think you've heard me say that as well. So I wanted to keep those things in the forefront. So we are in public service and we are people serving people. So the heart of any successful department lies in its dedicated staff and the public health workers who tirelessly work day in and day out to protect the health and well-being of our community. We extend our heartfelt thanks to each one of you who works in public health here in Delaware County and across the country. From epidemiologists tracking the spread of diseases, I see some epidemiologists in the group, to our nurses administering vaccination and following up on disease investigations, our disease investigation specialists who work tirelessly behind the scenes interviewing individuals to prevent the spread of diseases. By promoting preventative measures, I have a lot of population health folks out there. You do cooking classes, you're at a lot of events and tabling. Environmental protection specialists, they do the hard work of conducting inspections at restaurants. Our administrative assistants and all of those, a cadre of support staff that help us every day, and our public health preparedness folks, which we probably don't need to mention just how vital they've been over the past few years in our public health world. So this is what makes a community healthy and vibrant for everyone. So your unwavering commitment and expertise are invaluable, especially during times of crisis, whether it's responding to disease outbreaks, providing public health-focused healthcare services, or conducting vital research to advance our understanding of health issues. Public health workers go above and beyond to ensure the health and safety of our community. And as I was talking with a colleague earlier this morning, and I said at a conference that they said, in your job description as a public health worker, everything's in your job description. Nothing's not on your job description. And I thought that really resonated. Like every day, you never know what we might be doing. And so we, as public servants, do what needs to be done to get the job done. So as mentioned, the Delaware County Health Department operates on the foundation principles of preventing injury, disease, and premature death by promoting healthy habits and protecting our community's health and environment. Over the past year, the Delaware County Health Department has been working on completing and finalizing its first community health assessment. The community health assessment helps us gain a complete understanding of the public health issues affecting the Delaware County residents and allows us to collaborate with our partners and solve these complex public health issues of today. This past December, the Delaware County Health Department launched the Deterra drug deactivation system, and it contained resources for substance use disorders, and we did a destigmatization mailing campaign where over 70% of the household addresses in Delaware County received one of these pouches to be educated and used to deactivate any unwanted drugs. In the past year, interesting. Not sure what my scribbles mean there. I'll read it as it's written. In the past year, regular health checkup opportunities with partners have been made available to the Delaware County Health Department residents. We hold sexually transmitted infection and HIV clinics, we do immunization clinics, and we follow up with tuberculosis infections and treatment. We specialize in events. We had specialized events including blood pressure screenings, healthy cooking classes, mammogram screenings in collaboration with our community partners, and we're proud to sustain these initiatives moving forward. In fact, the next mammogram screening is scheduled for this Friday, the 5th, at the Wellness Center here in Yeadon, and that will be promoted yet again for coming events. The screenings are pivotal for early detection, providing timely intervention and potentially life-saving information. Residents interested in participating should contact the Delaware County Wellness Line, 484-267-2100, to schedule a screening appointment. The Delaware County Health Department also strives to promote and educate residents by actively engaging and communicating with them, empowering them to make informed decisions about their health. DCHD does not only offer health check events like mammogram screenings throughout the year, but staff members are also regularly attending informational community tabling events every month. Sometimes there are multiple in a month, providing information on the health department resources and services that are available. So residents are encouraged to check the health department's community clinic and event calendar on our website and follow us on social media for all of our upcoming events and opportunities, seasonal health tips, and our promotions. As part of this year's National Public Health Week proclamation, you heard Dr. Taylor speak about how it takes everyone to achieve optimal health. You have also heard us encourage residents to help us achieve this cleaner and healthier communities by taking care of the environment, by cleaning up litter and trash in our parks, streams, and neighborhoods. And with that, I'm excited because we will be doing a Clean the Green Park initiative. So on April 19th, in a few weeks, through the Keep Pennsylvania Beautiful and the Pick Up PA program, the Delaware County Health Department staffs will dedicate their time and participate in a targeted park for a cleanup effort. So we'll have trash bags and gloves and safety vests and necessary supplies so that we can clean up 2 parks in Delaware County. And this is really our gift back to the community. Every year when it's our birthday, we like to give a gift back. And so this year, this will be our gift back to the community. And why is this important? Because litter affects you and your community by negatively impacting community pride and health. And it can impact business development, tourism, and property values, all of which play a critical part in the overall optimal health of residents. So litter and excessive trash degrade the natural environment, and most trash takes years or even centuries to break down. And it can also create hazardous aspects for wildlife and attract disease-carrying mosquitoes and rodents. So we're looking forward to having that event, and you'll hear more about that as time comes. Again, following us on social media is a great idea to learn more. So in closing, I thank you for joining us on our 2nd year anniversary and National Public Health Week. It is with great pride that I celebrate with you these milestones of operating a public health department for Delaware County. Thank you.
Any questions? Can you, if you don't mind, talk about a few of the just big challenges starting the health department from the ground up over the last 2 years? What's a big challenge you all faced, and how did you overcome it?
Oh, wow. Where to start? The understanding that there was very little facilities, just even to house staff. So tomorrow, I was going to ask staff members that have been here for 2 years or more to stand up and say, tell me about your first day when you walked into the office. And so many of them walked in and may or may not have had a computer and may or may not have had a chair. So you're here today, and this is called Phase 3 of the Yeadon Wellness Center. And so this is huge. Like, this is an amazing milestone to have gotten to where we have everyone having a space. They have furniture, they have computers, we have networks, we have shared folders, we have a budget, we're paying people on time. And I know this all sounds silly, but in the beginning, those were challenges. Making sure that we had all of the aspects in place. We've moved into having the fleet of vehicles. Many people were hired understanding that they would have a vehicle that they could drive. And because of the pandemic and delays in production, we weren't able to deliver on the idea that everyone would have a car. While they were ordered, we hadn't received them. So we now have the cars, people are driving them, they're not having to use their personal vehicles as much for travel, and so that is another huge milestone. Anyone else want to throw one out there that you can think of? Oh, there were some clinics, starting up a clinic and getting the vaccine and making sure our refrigerators met the rigorous standards for being eligible to even operate what's called the Free Vaccine for Children program. I mean, it's a rigorous process, and you have to demonstrate you have backup. And if your backup fails, what are you going to do with your vaccine? Because we are responsible for a large quantity of vaccine that is provided to us at no cost. So you have to demonstrate how you can do all of that. Plus staffing and the homebound program, which is came out of COVID, where we could deliver COVID vaccines, and we've been able to maintain that program long beyond. And so I could go on and on. We could have lunch over it. Probably could roll into dinner. But so proud of the work, the perseverance of the staff. I have to say that they have had their own challenges in each one of their environments, and all the way down to, this was the job description we wrote for what you would be doing, and you just heard me say that, I should just say everything's in your job description, because sometimes we had job descriptions but didn't actually have it all planned out what it was going to look like. So it took staff having to sort of roll up their sleeves, and I've been saying leaning in and saying, okay, I guess I'm going to figure this out with you, right? That's a really unusual place to be in any type of organization, where you come in and you're like, there was no one here before you to teach you what you're doing now. Like, you're creating it with us. So I hope that's helpful as I'm describing what it's been like. Yeah. Next 2 years, where you all try to, just get even better in the positions that you're in? Yeah, love that question, because I've had to answer it a number of times in a lot of different environments, and the number one thing is we're going to master what we have to do right now for what we call our foundational public health services. So everything that we've established, it is operational, we are functional, we're doing a good job, we're aiming for mastery. And so within mastery, then we get to be in that space of how do we cross-collaborate? How do we bring on different partners? How do we think innovative in this 21st century direction of what are our challenges around, let me think of an example, could be housing insecurity, right? We know housing insecurity leads to a lot of health challenges, but we're not in a place to step in and solve housing insecurity, but at some place we'll be able to be there. So there's that. And then out of the community health assessment, and I did have those in front of me, we've prioritized 3 areas: promote whole person care, prevent mental health and substance use disorders, promote maternal, paternal, and infant health, and prevent chronic diseases. Those are our 3 priority areas. And then with that, we'll use the lens of health equity and then improving access and awareness of healthcare and community services. So the work that we'll be doing, and this is maybe even a new announcement to the team, we'll be tying our work back to these goals so then we can demonstrate back to the community that we've either done these with other community agents, county agencies, community partners, or within our own walls. So we'll begin to deliver on that. And out of this has built what's called the Community Health Improvement Plan. And there are committees right now. Many of you that sit on the committees are in front of me in the room. And they are setting the framework for the priority measurable outcomes they would like to see over the next 2 to 4 years. So I hope that's helpful. So it is going to be our second gift to the community on our birthday. It's ready to go. We're getting it loaded on the website, and Matt can follow up directly with you when it is available. Like with this week. Like I'm like days. It would have been yesterday. No, so I just looked. We have 92 positions that we've submitted to the state, that is our current cadre. I think we have a little bit of a vacancy rate, so we're sitting somewhere between 85 to 87. Oh, I would have to get you the details on that afterwards because I don't have those details right in front of me. Yeah, we can get you some stats on that. Matt can get those to you afterwards. So our budget sits around $19 million, and I want to be really clear that $11.5 million of that is grant funded. And so when I came in as the director of the health department, we talked about a $10 million budget. And so my goal has been, and I think I'm in agreement with council, that as long as the overall county contribution remains under the $10 million, we're staying within the expectation of what it would be like to operate a public health department. And within our first year, we decreased the county contribution by about 35%, leveraging grant dollars and using them really creatively to cover staffing costs, supply costs, operational costs. I can get them. It's about 11 million. I can get you better. And our federal dollars mostly come through the state, so we consider them state dollars, even they're through federal block grant, and then we have 2 federal grants. But I can get you that breakdown very easily because we just prepared it for the state. Matt, if you don't mind reminding me to get that to Kathleen. Thank you so much for all being here.